Your doctor has recommended that you undergo gastric bypass surgery. But what does that actually mean? Gastric bypass is a surgical procedure used to help a patient lose weight. It is usually recommended to help those who are morbidly obese, meaning that their weight problem has become a serious health risk. Most severely overweight patients overeat. Food enters the body through the mouth, travels down the esophagus, where it collects in the stomach. From there, digestive food passes into the small intestine. Nutrients taken from the food pass from the small intestine into the bloodstream. Waste travels to the colon and leaves the body through the anus. The amount of food that a person eats is partly controlled by appetite. The stomach plays an important role in controlling appetite. When the stomach is empty, a person feels the urge to eat. When the stomach is full, that urge goes away. Gastric bypass dramatically reduces the size of the stomach. With a smaller stomach, the patient is physically unable to eat large amounts of food. Gastric bypass also shortens the small intestine so that the body absorbs less of the food eaten. With less food entering the body, fat stores begin to be used. The patient loses weight. In the vast majority of cases where gastric bypass is recommended, the patient has already tried the most obvious alternative to surgery: dieting. By recommending gastric bypass, your doctor is telling you that dieting is not a reasonable solution to your weight problem. More drastic measures are necessary. Should you choose not to undergo gastric bypass surgery and you continue to be obese, you will most certainly be placing your health at risk. Complications associated with obesity include diabetes, high blood pressure, heart disease, and depression. Because of these risks, it's unlikely that your physician would recommend any treatment other than gastric bypass to treat your weight problem. But there are risks associated with surgery as well. On the day of your operation, you will be asked to put on a surgical gown. You may receive a sedative by mouth, and an intravenous line may be put in. You will then be transferred to the operating table. In the operating room, the anesthesiologist will begin to administer anesthesia, probably general anesthesia, by injection and inhalation mask. The surgeon will then apply an antiseptic solution to the skin and place a sterile drape around the operative site. After you are asleep, the surgical team will make a vertical incision down the middle of your abdomen. They will gently pull back the skin to expose the connective tissue beneath. Your doctor will then divide this tissue and the underlying muscle tissue to expose the abdominal cavity. Your doctor will gently lift the liver up and to the side to reveal the stomach. Your doctor will then cut the upper portion of the stomach from the rest of the organ. This upper portion forms a small pouch which is sealed with a stapling tool. The opening in the larger portion of the stomach is closed with staples. The next step is to divide the small intestine. The main part of the intestine is pulled upward behind the colon and positioned near the small upper stomach pouch. The other free end of the intestine is surgically stitched to the side of the intestinal loop. The other end is now attached to the small stomach pouch. A new route for food passing from the esophagus into the intestines has now been created. Finally, your doctor will check to make sure that all the new connections are secure and that there are no leaks. The liver and other organs are placed in their proper positions. A drain is put in place to remove any excess fluids. Then the team closes the surgical field by joining the muscles with sutures. Then the connective tissues are closed. The skin is sutured together and the incision is closed. Finally, a sterile dressing is applied. Most patients experience at least some pain following surgery, but if properly handled, it shouldn't present any serious problems. Pain used to be regarded as an unavoidable side effect of surgery, but today, pain can be managed with great effectiveness. And as the patient, you have an important role to play. Before surgery, be sure to ask the medical staff about the type and duration of pain normally associated with your surgery. Find out in advance about your pain management options. Work with the staff to develop a pain management plan. Discuss your options. There are alternatives to drugs that can lessen your need for pain medication. Ask your doctor for help in finding a pain management class. Many of these workshops teach helpful relaxation techniques, positive thinking, and nerve stimulation exercises. Following surgery, make sure to let your nurse know right away how you're feeling and whether or not you are in any pain. Be specific and help them to measure your discomfort. If you're having trouble expressing yourself, try to rank what you're feeling on a scale from 1 to 10. Never be shy about asking for help. If you experience pain that just won't go away, report it to the nurse. Pain is an important indicator that helps you and your medical staff understand your body's healing process. At some point, you'll be moved to your room. While you're in the hospital, doctors and nurses will regularly check you, monitoring your progress following surgery. It's important that you realize your time in the hospital is an extension of the surgical procedure. While you're in the hospital, your medical team will continue to monitor your body's immediate reaction to the procedure just performed. That means that your time in the hospital is not really for rest and recovery, and you should expect to have your movements restricted and even your sleep interrupted by nurses or other medical staff. The amount of time that you spend in the hospital would depend on your age, your health, and whether or not any complications arise. Be assured that once your doctor feels that your condition is properly stabilized, you will be allowed to leave. Be sure to follow your doctor's advice and allow the full recommended period of time before you return to your normal routine. All surgical procedures carry some health risks, even of death, but gastric bypass surgery only rarely leads to complications. 2% of patients report bleeding or some infection around one or more incision areas. A smaller number of patients experience leaks or other defects causing internal infections. In fewer than 1% of cases, the new opening between the stomach pouch and intestine is found to be too large or too small and may require further surgery. In extremely rare cases, the surgery has resulted in injury to the liver or spleen, an intestinal obstruction, or death. But because gastric bypass calls for dietary and lifestyle changes, patients risk other health problems if they choose not to follow their doctor's eating and dietary instructions. These complications include vomiting, diarrhea, and even malnutrition. Your determination to make lifestyle changes will be the best defense against these problems.